We've seen many viewpoints come through from quite a few experts. We've heard about Wits University professor Shabir Mahdi, who said that it would be reckless for South Africa to discard the AstraZeneca jabs. And we've heard right now that the rollout is on ice. We know that many frontline workers, healthcare workers, and the like were preparing to start getting vaccinated. We've seen many provinces starting to preparations to vaccinate their healthcare workers this week. But at this point in time, everything seems to be on hold. And I see we are joined on the line now by Dr. Angelique Coetzee, Chairperson of the South African Medical Association. Dr. Coetzee, good morning to you. Welcome to the show.
Good morning. Just want to unmute myself and get rid of my mask.
Well, welcome and thank you as always for your time with us. Now, obviously, a major talking point now. We've heard about PPE problems in this country, the scandal. Now we're sitting with a vaccine debacle after a lot of hype was created last week when the 1 million doses arrived in the country.
It is true, and it is a problem. And I think what we need to understand is that everything is not lost. I heard that you say that Prof. Mahdi said we should not discard the AstraZeneca vaccine, and it's true. There's still a lot of good that comes from the AstraZeneca vaccine. The only problem is that it is, for us, we don't have enough data on severity of disease efficacy and also on hospitalization. We only have data on the AstraZeneca for mild disease. And hopefully there will come more studies to help us. We also need to understand that we have our own unique variant in South Africa, which is different from all the other countries. And when the government decided, under a lot of pressure, in December to start to order some vaccines, AstraZeneca was available, and at that stage it looked quite well. The studies looked well. Again, it was not done on our variant. So it will still work in the rest of the world. And maybe still, as I said, we need to wait for some data to be available for us before we can really make a huge decision on the value, whether it will be valuable in our country or not.
Yes. Now, obviously, time is of the essence because we've also heard, Dr. Coetzee, that the vaccine has got an expiry date, and I'm not too sure whether this has been verified, but we've heard about sometime in April this year, those vaccines would expire. So whatever decision is made has got to be quite urgent as far as the vaccine and its future in this country goes.
It's true. The expiry date of this vaccine is around about the 13th of April. So even what we need to do, whatever the government decides in the background to do with this vaccine, we need to do it before the 13th of April. Thereafter, we know that the vaccine might expire. I also know that Dr. Anban Pillay said that they contacted India to ask whether these vaccines, the expiry date, whether that is a set date or whether there's leniency on that date. So if they haven't had anything yet, so if there's leniency on that date, it will give us a bit more leverage to conduct more research on that. But again, I'm going to stress, this is not a bad vaccine. And people should not say that AstraZeneca don't know what they are doing, or that this vaccine is now lost for the rest of the world. It's just there's not enough data currently in our unique situation.
Dr. Coetzee, my question would be, should we have known better? Because we know that there was very little we knew about it, and did we basically jump the gun in procuring these vaccines without having the necessary data or possibly even some level of certainty whether this vaccine would work for us or not?
It's very difficult to say that because remember when we started to procure this vaccine, the data from Prof. Shabir was not available during that time. And across the world, it was, it was accepted that this vaccine with the preliminary studies would have been valuable in the fight against especially the normal SARS COVID-19 virus. As we have seen, it works very well in other countries as well. But unfortunately, due to a lot of pressure, so I would like to say that there was pressure from the public, the media, and maybe we should have waited a bit before we ordered all these vaccines. But again, we all know what happened during the peak in December, and pressure from public sometimes might be a bit unnecessary and adding to the hype. As long as we have vaccines coming in the country and vaccinate especially our healthcare workers before winter starts, even if we can do it before the Easter weekend, that would be prudent. Unfortunately, we now have these vaccines. I don't think they're going to discard it. I think we can use it in a different way. But that's not SAMA's decision. That would be the decision of the Minister of Health, how he and his team would like to use this vaccine going forward.
Yes. Now, just as a medical professional, Dr. Coetzee, and we know healthcare workers, frontline workers, obviously first in line in terms of receiving the jab. Just how much confidence would there be in the minds of frontline workers, on healthcare workers, to actually receive this particular jab?
Yeah, I think we might have resistance from the average healthcare worker, but there will still be healthcare workers who's not really sick, who's a healthy young person and willing to be maybe part of a trial going forward to see whether they would, if they get the vaccine, that they are healthy, don't have any comorbidities, and taking this vaccine, whether it would protect them against severe disease. But again, that would be a trial. I think it would be prudent to make sure that the average person out there, healthcare worker, knows what what vaccine he or she is going to get, and what the consequences might be.
Yes.
And then it's up to
Dr.
you to
Coetzee,
make a
I think
decision.
we are losing you slightly. Possibly,
Although
I think
if you
it has got to do with.
look at the Johnson & Johnson vaccine, that would be the vaccine that is being tested also.
Yes, sorry
better?
about that. I think we lost you a bit here and there, but I think we got a gist of exactly what you were trying to obviously convey. But I think let's wait and see exactly where we are and what sort of decisions are going to be made. But as always, we thank you for your time with us here on News and Views on Salam Media. We wish you all the best. Please take care and stay healthy.
Thank you so much. And stay healthy to all people out there, and please take care.
Dr. Angelique Coetzee, Chairperson of South African Medical Association, with us this morning on the vaccine that has been put on hold now. And we're talking about the AstraZeneca vaccine. And it's going to be still quite a major talking point. We come back, we are going to be staying with vaccines. We're talking about employers forcing their employees to take the COVID-19 vaccine. What is the legal perspective?